Our next guest is a physician and will use reproductive and anatomically correct references as related to a specific woman's health issue. And for all of her career, this doctor has had a passion to help underrepresented women who are suffering needlessly. She wants to help them avoid unnecessary surgery and gain back their quality of life.
Dr. Sandy Bevacqua joins us to talk about why she developed the Pelvic Health Transformation Program. Dr. Sandy, welcome to the show today.
Hi, thank you for having me.
And we are discussing something that can be difficult or uncomfortable for a lot of women to discuss, and I want to thank you for being here to do that with us today, because it is rather important. So tell us, what did get you interested in talking about this and researching it more?
Well, just to be clear, I'd like to start by saying I'm not a physician. I'm a PhD in molecular and cellular biology. And, but the topic that we're talking about here is pelvic health. And pelvic health includes many different types of issues, such as urinary incontinence, urinary urgency. There's also pelvic organ prolapse, there's pelvic pain syndromes and vaginal pain syndromes, and also several types of sexual dysfunction.
And so why is it so important that we're talking about these specific issues?
Well, we're talking about these issues because they are so prevalent, and more so than you would even believe. Approximately 50% of all adult women have pelvic health disorder to some degree. That's shocking, isn't it? And the most prevalent of those is urinary urgency and urinary incontinence. Urinary incontinence being the most prevalent. 45% of adult women have urinary incontinence to some degree. And it starts in our teens. And as we get into our 30s, it is more prevalent, not necessarily having to do with birth. So about 1/3 of our 30-year-olds have urinary incontinence to some degree. And by the time we get in our wisdom years, postmenopausal years, we, depending on the population, 2/3 to 3/4 of the women have these issues. And men are not immune. About half as many men have these issues in the same age categories. So what I will we do know that childbirth does have something to do with this. Women that have had children, actually, one vaginal birth will leave a woman about with a 50% chance of having one or more of her organs prolapsing. And what that means is it actually can fall down into or through the vaginal space out of her body. And that can be very shocking, as you can imagine. And the exciting news is that individuals that have these issues do not have to worry so much anymore, because we have solutions. About 80 to 90% of the cases can be solved with non-surgical intervention.
Dr. Sandy, I want to ask, why do you think more women aren't being upfront with the fact that they have these issues?
Well, I can tell you that the whole subject of urinary incontinence and urinary urgency is one that most ladies do not want to discuss, not with their partners, with their friends, and even with healthcare providers. It's embarrassing. And you can imagine that, we hope that it goes away. You start having a little trouble, and we hope that it goes away. But what happens is it gets worse if it's not addressed. And many women have been told that urinary incontinence is something that just happens. It can be, it's something that should be accepted. It's something that comes with age or with having babies, and that's just not true. So, we just want to make sure that women understand that this is something that can be addressed and not to be embarrassed about.
So. Now, is there symptoms or something that we should be, if I'm watching this right now and I was like, well, maybe I'm one of those women that are experiencing something like that, how do you know?
Well, I've written an ebook called The 20 Early Warning Signs of Pelvic Floor Disorder, and actually that's available for your viewers. All they need to do is go onto the website, pelvicbowlofsteel.com/home, and they can register and receive that book for free. And I want to encourage the viewers to go ahead and share that with especially the younger women, so they don't have to deal with these problems later in life. And
And Dr. Sandy, we've heard that Kegel exercises could actually be something that might help some of these issues, but that's not actually the case, is it?
No. Imagine that you've if a woman has urinary urgency or urinary incontinence, she's going to have a weakness in her pelvic bowl, somewhere around that bladder or urethra. She'll have a weakness. Well, the body is set up to have a strengthening of one area to compensate for weakness. So if you hurt one foot and you limp, the leg you're using is going to get stronger, the other one gets weaker. Well, in the pelvic floor, when one side gets weaker, another side can get stronger. And now ask that woman to do a squeeze. What's she going to squeeze, the strong ones or the weak ones? She's going to strengthen the strong ones, and the imbalance becomes worse, and she can end up getting one of the pelvic pain syndromes as well. So the incontinence can get worse and the pain can get worse. And so I want women to understand that there's a way of balancing the pelvic floor. A balanced pelvic floor will do well with Kegels. So that's why you young ladies need to keep up with your Kegels and make sure that you stay balanced, okay?
Stay balanced, though. That makes sense. And I know we're going to see you again, doctor, here in a few weeks. What are we going to carry this conversation on with?
Well, we're going to be talking a little bit more about pelvic organ prolapse and also the pain syndromes and some of the solutions to these and the sexual dysfunction and such that comes with pelvic health disorders. But I also wanted to offer your viewers, if they call my office, and the number is 520-743-0575. And if they mention KGUN9, I'll be happy to donate my time. That's why I'm stepping forward. My heart goes out to those that are suffering. And I will give a free 10-minute consult and maybe get people started in the right direction, give them an idea. Because the solution for one woman is not going to be the solution for another.
For everyone.
Every person that comes to my office that I assist ends up having a very unique, individualized program in order to resolve her issues.
Well, doctor, thank you so much. And again, we'll see you again in a few weeks. But I'm going to re-go over that. You can receive a free gift from the doctor, the 20 early warning signs of pelvic floor disorders, by registering at pelvicbowlofsteel.com or call 749-0575 for a free 10-minute appointment. That again is 749-0575.